Hey guys, it's Dr. Russell here. I'm your friendly neighborhood lumberjack. Wait a minute, I'm an orthodontist. We're going to talk a little bit today about some photos that you guys can take from home to help us accomplish virtual appointments. It's pretty easy, but there are a few details we want to talk about. First of all, you're probably going to want to get a friend, okay? So Dallas here is our patient. Her friend is Tess, and frankly, they are quite friendly. They're going to be showing exactly how this works. So anyone that has a really good, all modern phones are so good with their cameras these days that I think you'll be able to take really good quality pics. But I need to be able to see what's going on. So we're going to talk a little bit about technique. You're going to also be taking these photographs and emailing them to us, virtual@russell-orthodontics.com. Again, virtual@russell-orthodontics.com. We're going to review those and get back to you with our findings, okay? And so you also want to make sure you wash your hands very, very well, okay? Both the person who's taking the photos and the person who's sticking their fingers in their mouth. You could choose to use spoons, and we're going to go over that technique, but it's a little bit better if you use your fingers because you can really get those lips away from those teeth and take an even better photo, okay? So we're going to talk a little bit right now about the specific technique, okay? All right, great. So we're going to talk about technique now. Dallas, if you would grab those spoons, we're going to show you the spoon technique for those finger phobes out there. Go ahead and turn the curved part towards your teeth, okay? And then reach in there, and what you're going to do is very much like the retractors we use when you take the original photos. You're going to pull your cheeks out of the way, and you can see a reasonable photo here. It's just that look at the way that the lips stretch out. It's almost like a ship in a bottle look or something like that. So it's going to be tough to not get shadows in there, and it's not that great, or not as great as fingers. So let's show the finger technique, okay? And so now, after having washed really well, and hopefully in a very well lit area, you can actually take two fingers, top and bottom, and do like Dallas is. You're spreading your fingers apart a little bit, right? And you're also biting together. And do you see how I'm bringing the camera in here? And that's a really nice photo. Everything's centered up. I'm actually gonna let Miss Tess be our picture taker. So just come in here, Miss Tess. I would recommend that you turn your flash on at first. And we're going to review and see if maybe that's the best way to do it for your particular circumstance. But notice that she's really lined up with the bite. And also notice that she's not really centering the screen up so much as the camera on the screen, if that makes sense. So if you would also make sure you're not too high toward the nose or too low toward the chin. And once you're centered up really well, and touch the screen so it'll focus, you're close enough to show the teeth really, really well, but not so close that it either gets blurry or over illuminates with the flash. So once you feel confident, go ahead and click that photo. Then we're gonna pull that up and we're gonna see if we like that. The truth of the matter is I think that's a little over illuminated. It's a really good photo otherwise, but I think it's almost too bright. It just washes out the detail. So let's turn the flash off and take that one again. And so Ms. Dallas is gonna take all the same positions here, and once you're confident, you can guide the patient a little bit if they're just not doing quite enough work with the fingers to get the. That's actually better. So I'm liking that a lot. So in this particular situation, we're gonna move forward without the flash. So go ahead then, Dallas, keep your finger there. Get that camera in position. We're gonna actually lean back so that we can see how the lower teeth relate to the upper. This is a special one. It's the most difficult one. You gotta pull your lower lip out of the way as best you can. And you can see if I can tell whether or not you can actually see the bite. Now, I like that. So go ahead and take that photograph. Boom, I'll be able to see the overbite. That's really what it is. Let's move over to the side, okay? So reach in there, Dallas, with two fingers. You'll notice that if you only use the one hand, you're really not able to see it as clearly as if you put the other fingers in and actually pull your lips away from the front teeth. It just makes a better shot. You're just gonna have to do a little bit more work with those upper fingers to get it away from your back teeth, because that's what we're most interested in. So see if you can get that top finger and that top lip out of the way a little bit better, Miss Dallas. And once you're comfortable with that orientation, again, you're level with the bite, go ahead and take that photo. Looks good. Let's go to the other side. Same idea. So Ms. Tess doing a great job here. So you may have to take a few photos until you feel really good about it. So right now it's just too much cheek, not enough teeth. And so you want to orient your phone around to the front a little bit if you have to. We're still trying to see the back teeth as best we can and get those cheeks out of the way. But once you're able to see that back bite and the patient's pulling their cheeks away, go ahead and snap a photo. That's a good one, actually. So now we're gonna show the top row of teeth and the bottom row of teeth by tilting our head backwards and pulling you're pulling the lower lip, so let's pull the upper lip away, all right? And then lean way back until you can see the top row of teeth. Nice, go ahead and take a photo there. Same thing on the bottom, all right? So just here. Now you'll notice, guys, those are actually 6 photographs. One from the front, straight on, one leaning back so I can see how the lower and top teeth relate, one each from the sides, and then the top row and the bottom row. 6 teeth. You're going to submit those email to virtual@russell-orthodontics.com, and we're going to review that, get back to you, and we appreciate it very much, and look forward to seeing you guys very soon. All right, be well. Bye-bye. All right, guys, so now we're gonna talk about technique, and we are not gonna solicit Bob's help, okay? So Bob, you're not invited. But what we're gonna do is actually show you the spoon technique first, okay? So not too high or not too low and not too angular. Do you notice how if you were to take the camera and actually slip it this way,